Hi everyone, I'm Sophie and welcome to the video. Today I'm going to be giving you like a little update of what it's like to be a nurse in the NHS. I've had some questions in the comments, so I thought it'd be best just to make a video and give my answers. So the first two questions are kind of linked. Do I enjoy being a nurse and is it my dream job? Short answer is yes to both. I absolutely love being a nurse. There is nothing that I wanted to do more than it, nothing I can see myself doing other than that. I've always wanted to go into some medical profession and nursing just happened to be the one that I fell in love with. Nursing isn't for everyone. You do have to be a certain kind of person to enjoy it and to do it, and you will usually find out whether you are right for it or not when you start your training and you go on to your placements and you get a feel for how the wards work and what your role will entail. The next question is, what do I do? What are my duties? As a nurse, you do quite a lot. The best way for me to explain what I do is probably to go through how my day is structured. So when I get onto the ward, we have a handover of all the patients and then I get allocated a team to be on, team A or team B. Within that team you'll have a nurse and some HCAs, maybe some students, maybe we'll have two nurses, maybe we'll have a band 4. It really does depend on who's on shift. From then I'll make a plan with my HCAs how the morning is going to work out. I will usually start off with my medication round while the HCAs go and start some personal care, help with some feeding, make some beds, that kind of stuff. Once I've finished my medication round, I will go and help with any personal care that needs doing. At about 10:30, we have a little catch up, just a quick 15-minute update, what's going on in the ward, any poorly patients, any concerns, that kind of thing. Throughout the day, I'll be liaising with the MDT, so physiotherapists, occupational therapists, doctors, if they're going for an x-ray, anything like that, I will be discussing with the other healthcare professionals about the care of my patient. Some other little things that we do is printing off like request cards. Say if someone has loose stools and you think it's going to be infectious, you will get on the system, request some test cards, print them off, get samples, send them off. You'll be doing dressings. If people come in with any leg dressing, you can talk with the tissue viability nurses to see how you need to do the dressing. Other referrals, such as dietitian referrals, if you think someone is severely underweight and they're not eating, you will take that initiative and do a referral. Anyone who's diabetic, you'll be checking their blood sugars regularly. If they're quite unstable, you can do a diabetic referral, get them seen. You'll also be conducting observations, spotting a deteriorating patient. If you think they're looking more poorly than usual, getting the doctors to come and see them, informing the nurse in charge of any changes, and yeah, just looking after your patients. At the end of the day, you are there to look after your patient, but you're also there to support the families. Now, I work in elderly care, so a lot of patients can be quite poorly, maybe end of life. And you have to look after your patients' relatives as well. Make sure they feel supported, make sure they are comfortable, make sure they have the answers to the questions that they want. Because if you give them a negative experience with the care that their family is getting, they're going to carry that negative experience with them for the rest of their life, and they're going to think badly of nurses, the ward, the hospital, the NHS as a whole. You'll be getting commodes and bottles and cleaning people up and all that kind of stuff, and it's really different on any ward you work on. Obviously A&E, you're not going to be doing the same stuff as you do in elderly care. It's completely different. Last two questions I think kind of link together. Is it worth the studying and do I get paid enough? Studying was very difficult for me. I am not very academic at all. In my first assignment I got 15% and you need 40% to pass. I'm the first one to go to university, one of the first to go to college. My parents don't have any background in higher education, so it was quite difficult for me to have family support, but I did have the support of my tutor group. They are absolutely amazing. The best group of friends you could ever ask for. They're so funny, they're intelligent, supportive, and that is what you need. I will just say, everything tends to happen when you study nursing. I've had friends and family pass away. My dad had a heart attack. My nan got diagnosed with cancer. I've had a bit of a shit 3 years, if I'm honest, and so have many other people. It doesn't matter. I don't think it matters if you do nursing or you do a different course, so don't feel scared to go and pursue nursing because you think everything bad's gonna happen. At the end of the day, it makes you a better nurse, 100%, especially if it's medical, because you can draw on them feelings, on them emotions, and if you come across a patient or relatives in the same situation as you are, you can empathise with them and you can give them the support that they need because you understand it more than, say, another nurse might. But yes, the studying is worth it. It is a lot. There are times where you'll want to drop out and not want to do it, and you'll be crying, and it'll feel like it's never going to end, but it does. You'll get there in the end. In terms of pay, I get paid just under £12 an hour, I think. My salary works out at 21, just over 21. I don't think it's a problem, my wage. There are lots of nurses that want a pay rise and stuff because of the amount of shit that we get put through. I won't deny that it's a difficult job and it's stressful and it's upsetting, but I don't do the job for the money. I do it because I enjoy helping people. Yeah, a bus driver gets paid more than what I do, but a bus driver doesn't get the same satisfaction as what I do when I am helping a poorly patient to get better. That's just my opinion on nurses' pay anyway. In terms of just a little update from me and how I'm doing, I'm actually doing really well. I've just coming up to my 6 months of being there. Can't believe it. It is absolutely flown by. I can now do my IVs, all signed off on that. I'm feeling really confident in myself. I'm learning something every day. I've started taking charge of the ward on night shifts, which has been quite interesting. I go back tomorrow night. I've been on annual leave at the moment. I go back tomorrow night and I have a whole month of nights. So we'll see how that goes. I'm excited for the challenge. I hope this video has given you an insight into my view on nursing and how I feel about it. If you are going to go into nursing, I wish you all the luck. It is a brilliant job to have and you won't regret it. It is a struggle getting there, I won't lie. Everyone finds it difficult. Everyone copes with it in different ways, but just remember you're doing it for a good reason. Anyway, I will see you in the next video. Have a lovely day and take care. Bye bye.